viewers, radio listeners, internet listeners and viewers, members of the press, colleagues. I have one announcement I'd like to make, and that is that there are indications that Moody is going to downgrade St. Martin. Moody's is an international organization that issues ratings for countries. The Moody's ratings are important in terms of investors who want to invest in a country needs to know how the country is rated, as well as if the country have needs for borrowings, that the financial institutions that the country is approaching could get confidence or a rating in terms of what they can expect a company or a country to perform once it borrows money. The ratings from Moody's that we've had up to now was a rating of Baa1. The rating that is being indicated, and a final decision has not yet been made, but all indications are that Moody's will downgrade St. Martin to a rating of Baa2. It sounds like when you go from 1 to 2 that you're making progress, but not in terms of ratings. A rating of Baa2 is not as good as a rating of Baa1. The reasons behind this possible downgrade is that we continue to perform from an economic point of view at a very low pace. Moody's information indicates that our growth has been now for several years 0.5. That's what they're indicating. And that the outlook for future, given the state of affairs as far as the global world is concerned, and what is to be expected there, that there are no indications that growth will change significantly as far as St. Martin is concerned. In other words, it's projecting that we probably might have this year a growth of 0.3 or 0.5 again. This is significant in terms of when we look at the region. There are other islands in terms of economic growth that is doing better than St. Martin. In other words, there is something that we're not doing that we have to start to do. And if we don't do it, then the trend will continue that we are going to be continue to be downgraded. Not only in terms of the economic growth that is being projected, but in terms of the expectations as far as finance is concerned, and the institutions that we have taken a look at their progress, Moody's find that we have not made any strides in the past. It means that we need to look at these institutions, and we've got to make decisions to upgrade and improve these institutions, that they meet the standards that Moody and other international organizations look for. I've said before, we have to change. If we do not take the necessary steps to change, we will have more of the same in future as we have had in the past. Another item that they mentioned is that in 2018, CFT is scheduled to terminate their services, quote unquote. If it does, then we will be exposed to world market rates as far as interest rates is concerned. Because of the present CFT arrangement, we have a favorable relationship with the Netherlands that allow us to borrow at 2 and 2.5%. When and if the CFT arrangement terminates, if you do not have in place the necessary institutions to be able to carry out the supervision that meets international standards, it means you will no longer have that 2.5% advantage, and that you will then, such as the case is presently with Aruba, borrowing on the international market, be exposed to borrowing at 6-7% for your needs. What I'm signaling with this is that we have to change, and we have to do things differently, and we have to pay attention to the benchmarks that we have to meet in order to have a better grade as far as our performance is concerned.
I'm Emil Lee. I'm the Minister of Labor, Health and Social Affairs, and I'm happy to commemorate World Health Day 2016 under the theme of Be Aware, Get Diabetes Care, which is an initiative from the Ministry of Health, in particular our Department of CPS or Collective Preventive Services. Diabetes is one of the most prevalent diseases in our country. It is a disease where the body cannot properly process the sugar within its system. So it has a number of impacts on your health if it's untreated, including possibly kidney disease, amputation of limbs, in particular lower limbs, cardiovascular disease, nerve damage, and for men, erectile dysfunction. But the thing is, actually, diabetes is one of the diseases that is most manageable. Only 10% of diabetes patients require insulin injections. The others, type 2 diabetes, actually much of it can be managed by lifestyle choices. So that's very good. What that means is if you find out at an early age that you are prone to diabetes, you can do a lot to manage the disease, and with simple lifestyle choices. As a matter of fact, my mother is diabetic, and so I always take very personal care to make sure that I maintain a good body weight so that I'm not prone to contracting diabetes myself. So one of the first things to do is to make sure that you're not overweight, and that very often is related to being active, making sure that you're exercising, but also paying attention to what you eat. Unfortunately, in our society, a lot of the drinks that we drink, even juices, things that you believe are healthy, are actually laden with sugar, very heavy sugar contents, as well as processed foods. And so this is one of the things you really need to be careful about, is eating white breads, pastas, things like that, things that you might not necessarily think of as sweet, but the body converts these carbohydrates into sugar. Also, because you have a tendency to contract cardiovascular diseases, things like smoking are also high contributors towards increased complications. So a lot of it is about being aware of the condition, so that means diagnosing it at an early stage. And a lot of it then can be treated with lifestyle choices like being more physically active, keeping your body weight down, but really being aware of what kinds of foods are good for you to eat and how you should manage it. And so that means monitoring, going to your family doctor. For example, you can also test by test kits at home where you can test your blood to see what your blood sugar levels are. So a lot of it can just be done by managing your lifestyle. One of the other things is helping people who are already diagnosed with diabetes to help instruct them as to how to take care of themselves. For example, foot care, so that you make sure that you're taking care of your body and not letting the disease get to the point where you need more invasive procedures.
I want to address today an issue that has been in the news for the last couple of days. That is namely the new contracts for the solid waste collection. The 1st of April 2016, the new contracts took effect. And as anticipated, we calculated that there would be, in the transition period, some hiccups. But after, I'll say about 6 days now, there's basically 3 parcels that are areas of concerns. That is namely Parcel 1, the Phillipsburg area, Parcel 5, and Parcel 6, that's the Cul-de-sac Basin and the Little Bay Cahill area. In the Phillipsburg area, there is a distinction, and this I want to make very clear. There is a distinction between the household and the commercial waste. The contractor that was awarded Parcel 1 is living up to his obligation by collecting the household waste. However, what we have seen in the last few days is commercial waste, which is the responsibility of the commercial establishment, not being collected in a timely fashion. The disposal of commercial waste, as indicated for stores and businesses, are as follows. The offering for collection of commercial waste will be done in a proper manner within a minimal impact for passers and pedestrians. Commercial waste derived from regular businesses that closes at 6 p.m. will be picked up no later than 8 p.m. Commercial waste deriving from restaurants and bars will be picked up no later than 12 a.m. Presently, it is obvious that this is not the case. The ministry will carry out inspections in the area of Phillipsburg, and if found in violation outside the set times, as mentioned, these persons will be fined in accordance with Article 19 and Article 20 of the Waste Ordinance. It is forbidden, once again, to offer commercial waste to the gathering service. The producers of commercial waste are obligated to dispose of this waste regularly to the assigned landfill at their own expense. They are authorized to encumber third parties with the task. The disposal and the offering for collection of commercial waste, as well as the collection, will be executed in an efficient and effective way. Non-compliance with these conditions can be punished with a fine of up to 5,000 guilders in accordance with Article 38 of the Waste Ordinance. So again, as I indicated, what we are seeing in the Phillipsburg area is that the contractor is living up to his obligation. He's collecting the household waste. The commercial entities in Phillipsburg are the responsible entities for their own waste. If they so desire to hire the services of the contractor responsible for Parcel 1, they are free to do so. But we will go after who is responsible, which is the commercial entities. They cannot point to whatever contracts they have with third parties. They are the one responsible for the disposal of their waste. So this is something I've indicated to the ministry, that inspections take place on a frequent basis in the Phillipsburg area, as that is the commercial hub of the country, and they will be doing so at all hours. And again, if persons are found in violation of the articles I mentioned, we will impose a fine on them. The next parcel, parcel 5 and 6, these areas have my concerns. Discussions was held with the contractor responsible for the mentioned areas, and measures are being taken to rectify the situation. I want to make it clear to the citizens in those areas that this situation has my utmost attention. If the contractor neglects in certain areas, I will instruct that a third party carry out the work at the expense of the contractor. If after that process the situation does not improve, I will begin a process as stipulated in the terms of reference and the contract to assign those parcels to the next in line as the results of the evaluation procedure. I will not let the community in these districts endure this type of service which is below the minimum requirements expected by the community. In closing, I want to indicate that in short, we will publish to the community so that they are aware the schedules indicating the dates and times that the waste will be collected. We want to prevent situations where if you know at a certain time the waste will be collected, that your waste is not disposed to the side of the road where we have stray dogs and things, we could make the situation even worse. So we will publish then the times and dates that the community is aware at what time the garbage collection will take place.
Our society is made up of morals and values. What do we mean by morals and values? Morals are also called principles. Morals are habits with respect to right or wrong conduct. Morality is ultimately a personal compass of right and wrong. Values are standards or ideals. Values are important and lasting beliefs shared by the members of a culture about what is good or bad and desirable or undesirable. Values have major influence on a person's behavior and attitude and serve as broad guidelines in all situations. One important result of morals and values is integrity. Without morals and values, there can be no integrity. The word integrity is much used in our society of late. That is understandable, because integrity is one of the main building blocks of a well-functioning democracy. Without integrity, corruption can take hold of a community. Corruption is defined by Transparency International as the abuse of entrusted power for private gain. The gain can be either financial or non-financial. In a worst-case scenario, extreme corruption could lead to poverty and could be the cause of hardship. An impoverished community can quickly turn chaotic and unstable. This scenario should make it clear that the fight against corruption is necessary. More importantly, every one of us, as citizens, must take responsibility for this fight. We should all be concerned about the spread of corruption, which can be compared to a virus capable of crippling government, discrediting public institutions and private corporations, as well as having a devastating impact on the human rights
I'd like to
of the
report,
population.
I just returned last night from a fact-finding trip regarding healthcare, our medical referrals to Colombia. Just for the record, this trip was financed by myself personally. Given our budget cuts, I continue to finance my fact-finding missions myself. So the purpose of visiting was to get a first-hand assessment of the health care that our people receive when we send them to Colombia. Colombia is one of the countries that we send the most referrals to. And my instructions to the organizers, we work through a company, or SZV works through a company, Comiva. My instructions, they assisted me in terms of making my itinerary, my hotel reservations, transportation, etc. So my instructions to them were that I wanted to be treated as a patient of SZV. So in other words, the ground transportation, the hotel accommodations, the trips to the hospital, all of them were the same as what our people experience when referred abroad to Colombia. So my purpose of visiting was to see the quality of the hotels, the medical facilities, the transportation, and as well as air and ground and general level of service. Visited to Cali, Bogota, and Medellin. During my trip, I did try to meet with any patients from St. Martin that were currently receiving treatments in Colombia. Besides to see a face from home, I think it was as well to interview them as to what their experiences during their stay in Colombia was. And actually, out of the 6 patients that I met, all of the feedback was extremely positive. I went to Colombia with a number of questions, or let's say a number of concerns. There's been rumors, for example, in the past that we send patients to Colombia and they go there for a short stay and their stay gets extended and extended. Mortality rates, that we send patients there and that the outcomes are not always very favorable. Questions about the quality of care that the patients are receiving, as well as language issues, whether there's really communication problems when we send patients to Colombia. And in my findings, I think there are a lot of very reasonable explanations. And just to give you a couple of examples. There was an example, for example, where a patient was sent for cardiac surgery. When the patient arrived in Colombia, it turned out the patient had diabetes that was unchecked and high blood pressure that was not properly controlled. So although an appointment was set up, the transfer of information, the communications between St. Martin and Colombia didn't happen appropriately. So when the patient actually arrived for treatment, the treatment had to be delayed because the diabetes and the high blood pressure had to be brought under control first, which results in an extended stay, rescheduling of appointments, so just to give an example. In terms of mortality rates, there's a question as to what the referral policy is from St. Martin. So some of the comments from healthcare providers in Colombia was, the people that are being sent at very late stages. So for example, if it's a cancer patient, the patient's sent at a stage where the cancer is already metastasized heavily throughout the body and makes it very difficult to expect positive outcomes. So it leads to a number of questions as to what we're doing in St. Martin in terms of what our diagnostic capacities is and what our referral procedures are. So in general, my findings, I'm very comfortable with Comiva as our partner in Colombia. I find that they're very professional. I find that they were very transparent. Any records, any facts and figures that I've requested, they've responded to and sent in a very timely manner. I have some concerns about the referral process. There are stories about how patients are arriving in Colombia without all of their records in place. Also, there's some things, for example, Bogota is a city that is relatively cold, high elevations, and we're finding that sometimes patients are not being properly informed as to what to expect, so they're arriving in Bogota expecting warm tropical climates only to find out that it's cold. So there's a number of communications issues that clearly need to be improved. My findings were that many of the hospitals were very modern, internationally accredited. Many of the physicians that I met with and staff and administrators all spoke English fluently. Many of them were trained internationally. And overall, my experience was extremely positive. Some action points coming out of my visit. It's strange to find that there is actually no agreement in place between SZV and Comiva. This is something that's been ongoing for a number of years. So in our discussions, I will make sure that an agreement is actually structured between SZV and Comiva. And actually, the Bess Islands also works with Comiva in Colombia. And so as much as possible, we've been in communications with representatives from the Bess Island, and we're going to try and piggyback off of any work that's already been done by then. I don't see any sense in reinventing the wheel. If there's good agreements in place, we certainly would be happy to adopt those protocols. One idea that I have come up with, I've suggested to Comiva, and I'm discussing with the ministry currently, is the idea of an annual meeting on island where we review all of the cases for patients that were sent abroad what were the outcomes, what are the lessons learned, both positive and negative, so that we can make sure that we're improving our overall level of care. Establish improved protocols for communication. They've also offered to assist with telemedicine. I think that that's something that might help us to improve our diagnostic capacity here in St. Martin, and making sure that when we're sending people to Columbia that all the information's been properly communicated. Looking at quality control protocols for our referral process. So there's a number of gaps, I think, in the way that patients are referred, the timeliness, how the decisions are made, and so that process will be under review. A review committee for patients upon return. So my suggestion is that since we send a few hundred patients to Columbia every year, I don't see the reason why we couldn't actually review the outcome of every patient that's been sent abroad, so that we can figure out if we're doing things in a correct manner, in a cost-efficient manner, and in a timely manner. And like I said, review the entire referral process.